Welcome everybody to the March 20th, 2023 Health and Human Services Committee meeting. Happy first day of spring. I think the equinox happens at 4:23 this afternoon, or 4:24. All right, for changes to the agenda, we have one item that is getting added, reappointment of Tompkins County Public Health Director, and that should be on everyone's desk. Everyone's got that? Good. Any other changes to the agenda anybody knows about? No? Okay. Public comment, I don't see anyone here in person, and there's nobody on the big board, so skip that one. Chair's report, I do not really have a chair's report, so we're just zipping through. Maybe we should just adjourn now. We have Bridget Nugent here to give us the administrative report.
Yes, thank you, Dan. I'm actually going to turn it over to Lisa Holmes, who's attending virtually.
Oh, thanks, Bridget, and thanks, Dan. Just wanted to provide the committee with a brief update on the security measures at the Human Services Building and where we're at with that, and to make everyone aware that we have been working diligently to implement the security measures at the HSB, and we've come across a few different roadblocks along the way, but I think that we're working through them and are in a good place right now. So we, as you know, have contracted with an agency to provide us with the security in the building, and we were waiting to implement when we received the metal detector or magnetometer type device for the screening device. When that device arrived, we had some trouble because the metal doorways at the Human Services building were setting off the device, and because of the layout of the lobby, made it very difficult to get the distance needed from the door. Went very close up to the actual reception area itself. So we were kind of fighting against the architecture in the lobby. So we were trying a number of different configurations, some of which would have required actual work to the building to implement, and we wanted to avoid having to do that. So I think after a lot of different drawings and consultations and work together with Alan Lockett from Facilities, Dawn Thorpe, our Employee Health and Safety Coordinator, Bridget Nugent's been very much involved, and Mike Steitley at Department of Emergency Response in cooperation with all of the department heads in the building, Kit Kephart, Dan Cornell, and Kate Shanks Booth. We've come up with a plan that that will work with very little additional architectural work that's needed for the building. So, and we plan to be implementing that and making those arrangements now. I think we're in the home stretch. The other piece of this that I wanted to make people aware of is that it was recommended through the security company that we're using, and it is in place in several other departments of social services throughout the state, is the addition of lockers for people who are utilizing the building to stow their belongings, and anything that could be set off in the metal detector, they can store temporarily outside of the building and be able to pick them up once their business in the building is done. And that eliminates a lot of issues that have arisen elsewhere when they don't offer that type of option. So that's something else that is being put into place with some policies and procedures around how those are going to be operating. So all of these things are going to be implemented in coordination with one another, and we're working with Dominic Recchio on the messaging of this to the general public, to staff, to clients in the building. So all of this is coming along now, and we're hopefully in the home stretch of getting it all implemented. I'd be happy to answer questions.
Any questions for Lisa? Thank you.
Okay. And then I believe, and Bridget can also speak to, there's been an addition to the agenda. Thank you very much. We were notified recently that Frank's reappointment as public health director is come up for reappointment, and we'd like to. I believe that there's a time frame on that as of April 11th that it needs to be brought back for the State Department of Health. So I appreciate your considering that at today's meeting.
Randy.
Yes, Lisa, that's a question. Why 6 years, out of curiosity?
I believe that's New York State public health law, that the public health directors, commissioners serve a 6-year term.
Yeah, why did I think the title was commissioner?
Oh, maybe I'm using the wrong title.
It's printed director on the page too, so.
It's mental health commissioner, public health director.
Wow. Every day I learn something new. Thank you. Okay. Anything else from Lisa or for Lisa?
Oh, I guess I also just want to say, in terms of, as you consider the resolution, that I want to thank Frank for all of the service that he's provided to Tompkins County, and it's with great enthusiasm that I recommend his reappointment for another 6-year term.
Thank you. All right. Well, that then leads us right into the Department of Whole. Oh, we didn't say where we were putting this resolution. Why don't we do the resolution right now? How's that sound? Does somebody want to move the reappointment of Tompkins County Public Health Director, 6-year term? Susan moves. Amanda seconds. Thank you. Any discussion? Amanda.
Well, I would just also thank Frank. It's been a heck of a couple years, and I think you've done a great job, and I really appreciate the overtime. I remember sitting here 3 years ago, January, and saying, oh yeah, that virus isn't going to come all the way here to New York. I totally remember that. And you were like, it's not really a problem, but we're keeping our eye on it. So thank you for everything you've done. I mean, during the pandemic, but everything else you have to handle as well.
Any other discussion before we vote? Okay, all in favor? That is unanimous. Thank you, everybody. All right. Congratulations, Frank. You're signed up for 6 more years.
Thank you. I appreciate the support.
Yeah, it'll almost be 2030 by the next time we do this. All right. So we are in the Department of Whole Health section of the agenda, and we have presentations of CHA and CHIP. So why don't you take it away and tell us what those mean and everything else you want to tell us.
Great. Thanks, Dan. I appreciate the time for this on the agenda. Every 3 years, we go through a process of completing a community health assessment and developing a community health improvement plan, so CHA and CHIP. We do this in partnership with Cuyahoga Health, as it's a joint effort between the hospital and the county health department. Samantha Hilson's going to take you through this presentation. She's been our lead and done the heavy lifting with her team to put this together. I just wanted to share that This is a community health improvement plan. While we in the hospital are tasked with creating it, it isn't a departmental plan, meaning it's not our work plan for the year. There are certainly things in there that we play a very specific role in and or partner with other agencies to do. But we really take a lot of effort to try to learn from the community what we need to be prioritizing, and also bringing as many people to the table as possible to help develop initiatives that can be, put in place across the community to try to help us reach our goals within the plan. So with that, I'll turn it over to Sam Hilson, and she'll take you through the presentation.
Okay, thank you, Frank, and thank you all for having us today. I'm very happy to be here, and congratulations, Frank, on your reappointment. Should I be sharing my screen, or the presentation was loaded into something? No?
Please just share your screen, Sam.
There? Okay, all right, great. Let me just get that up.
Sam, what's your title, out of curiosity?
So I serve as Director of Health Promotion here at Whole Health, and also Public Information Officer, doing communications across the department.
Thank you.
Okay, can you all see that now?
Yes.
Great. All right, so what makes a healthy community? This is our updated CHOT and CHIP, Community Health Assessment and Improvement Plan. And like Frank said, in partnership with Cayuga Health. Okay. So the purpose of this report that is required by all local health departments by the state is to build a healthy and equitable Tompkins County where every person has fair and just opportunities for optimal health and well-being. And this purpose statement that we have here is very closely aligned with the new Whole Health mission as well. So we look to identify key health challenges, determine gaps and disparities, prioritize strengths and resources that our community has to offer, and ultimately to advance health equity. So we use this big guiding question, how can we support a healthier, more equitable community? Thinking about how do we collectively enhance our efforts, resources, access to resources? How do we address economic, environmental, and social barriers so that we can improve our community conditions in which we grow, live, work, play, and age? So just an overview of the process. We review state and local data. We work with partner agencies to seek their input. We incorporate community voices and perspectives. We identify the priority needs, and then we select goals and interventions, primarily guided by the New York State Prevention Agenda. So this is a snapshot of the data that we look at. A lot is quantitative data from New York State. This is an image of the New York State Prevention Agenda that has a whole dashboard now. And then we're able to go directly to different sources. We do utilize the Youth Development Evaluation Survey that Tompkins County Youth Services works closely with the students, middle school and high school, to put out and collect information. And then I'll speak more about the community health survey. And this round we used a review of existing reports and plans that were in the community from partners who had done focus groups and collected some other qualitative data to inform some of our discussions. So the community health survey went out last summer, and it was widely distributed in the community. We had about over 1,500 responses that were eligible, meaning that respondents really completed the full survey. And so we were able, so we analyzed those responses. And my colleague here at Whole Health, Ted Shealy, and then our colleague Lara Perilla at Cayuga Health Partners really were instrumental in analyzing that survey, and I greatly appreciate their efforts. So, so this was the second time that we did a real community-wide survey like this, and got a lot of interesting responses. So I will just share 2 slides from that survey. So this is factors that create a healthy community. We asked in the survey, and I'm sure this is quite small, so I'll just give you the top 5 were good paying jobs, equitable access to affordable healthy food, safe neighborhoods, affordable safe housing, and affordable equitable health care. So those top 2 you can see were pretty dramatically, chosen by participants who were asked to choose up to 3 of these factors, and then it sort of leveled out and was a spread across the other options. In some of the conversations we've been having and other community presentations we've been doing, I just wanted to point out that at the sort of bottom of this list is sustainable actions to address racism. And we've had some discussion about how just its placement on the list might have impacted the responses, but also people have raised, how important it is for us to be thinking about that factor and how, the effect it has on some of these other factors that are higher up in this list. And then these 2 graphs, we're looking at respondents who were asked to rate their health in the following categories, and demographic questions allowed us to compare by race, health insurance status, employment status, gender, disability status, and current residence. And so here we have health rating by race and health rating by income, and the graphs show a lower self-perception rating for the population identifying as Black or African American for both physical and mental health, as you can see here, and then those earning less than $15,000 annually also have the lowest rating for both physical and mental health. So we think about sort of the understanding that many of our community partners, who do work in the community, what they have and sort of how we were thinking about this as part of the steering committee, that Tompkins County is often ranked as one of the highest counties in New York State overall for health, that this is part of the county health rankings that I think right now we're at number 2. We have lots of healthcare and supportive services compared to our surrounding counties. However, we also know that it's not working for everyone, and there are significant barriers to services and to overall health and well-being, which leads to serious disparities in health outcomes. And that some of the social inequities that we think about, income, housing, transportation, food security, are really drivers of these disparities. So that leads us into our improvement plan, which is really after we assess all that data and sort of the snapshot of health of our county, then we look to really prioritize based on the prevention agenda. And I would just like to say that that I'll share the website, but from our Whole Health homepage, you can get to the full report for the community health assessment and the full work plan or matrix for the improvement plan. And that is much more detailed than the examples that I'll share here, but I did include some in these slides for your reference. So the New York State Prevention Agenda lays out these 5 large priority areas, and the bolded ones here are the ones that we selected both now and from our previous round in 2019. So prevent chronic disease, promote healthy infants, women, and children, and then promote well-being, prevent mental health and substance use disorders. So in the interest of time, again, there are several examples here, but I'll just take us through probably one of them. So we have the goals listed here for chronic disease: increased food security, increased cancer screening rates, and increased early detection of cardiovascular disease, diabetes, prediabetes, and obesity. So for example, for increased food security, one of the activities being worked on in the community is increasing food security screening and referrals. And I wanted to point out that the Community Health Improvement Plan is strongly aligned with the Tompkins County Food System Plan that was approved in July 2022. And in that plan, it recommends that patients are screened for food insecurity at healthcare visits, and referrals are made to community health workers to assist with appropriate resources and making sure that specific food needs are met. So that's one example. For promote healthy women, infants, and children, I wanted to highlight our home visiting programs that we have here at Whole Health. So we have our redesigned Moms Plus program that has community health nurses go to homes of people who are pregnant in the prenatal and postpartum stage. And we also have our new community health worker initiative, including our PITCH program, perinatal and infant community health collaboratives, and that also is having home visits from a community health worker who can really help navigate different systems for people who are pregnant or have young children. So this is part of the reason we got that New York State PITCH grant, and one of the reasons that we chose this priority area to reduce racial, ethnic, economic, and geographic disparities in maternal and child health outcomes is because the data really continues to show a gap in several different areas, but one in particular is early prenatal care, and a difference between those identifying as Black and those identifying as white, that 85% of white births have early prenatal care and only 61% of Black births. So there's also differences across zip codes for these factors too, but the racial piece is definitely apparent. And then the last priority area is promoting well-being and preventing mental and substance use disorders. And there's some well-being and resilience goals. And then we have prevent opioid overdose deaths. And on the next slide is prevent adverse childhood experiences and preventing suicides. And so I think all of this is very relevant in our community. We have, again, many different community partners working on this, and Whole Health is certainly involved in many different ways with our mental health services. So at Whole Health, we've been undergoing extensive DE&I and trauma-informed training that we have a series coming up. The opioid task force is being developed in our community, and also our suicide prevention coalition exists. So lots going on around these different goals. So we'll go on. Again, just want to thank our steering committee, which we're also looking to expand probably for the next round of this community health assessment, but here are some listed. And I wanted to share a few next steps that we're planning on. One is that as part of the improvement plan, we have several different work groups that have been meeting now for probably the past 2 years or so. Again, in partnership, they're facilitated in partnership with Cayuga Health and Human Service Coalition, some of our partners. So we have one on chronic disease and heart disease and diabetes and cancer screening. And then we have perinatal and infant health partners who have been meeting regularly to think through some of the goals in this improvement plan and working directly on giving more input to our pitch grant as well, like in an advisory capacity. So that is ongoing work, and when we've been presenting to community partners, we're interested in having more participation in these work groups too, and we'll be developing more of a way to integrate the improvement plan into our existing mental health and substance use coalitions as well. And we've had a couple of different presentations over the past month or two, and just getting additional feedback from different groups like the Health Planning Council and Office for the Aging Advisory Board, Community Health and Access Committee, and then there was a health equity convening last week at GIAC. And so we've been just giving quick presentation and overview of the improvement plan so that we can get some feedback and talk with community partners just about how they fit into this plan. Many are referenced in the plan. And then really thinking through our process going forward of how we'll monitor and evaluate different activities and interventions that are happening around our community to further these goals. So I will end there, but certainly if there are any questions, let me know, or if anyone wants to look through more of the detailed plan, always available for questions.
Thank you. Are there any questions or comments about these plans? Randy.
I'm sure you can't put into 10 or 15 minutes hundreds of hours of work here, but so I won't try to delve into that. I would like to see the actual full plan, though. It'd be nice to get a copy of that. I did have a question. I think it was answered. I wrote my notes as it was going. Is diabetes and heart disease, are they the number one chronic diseases here? Or? I think that's what you...
That's a good question. The state does have them outlined by county of the main causes of death and illness. So I can get that whole list. I don't know that diabetes and heart disease are the number one, but I can get the list and we can share that out.
It would make sense that equitable, affordable health care would be number one. So people that don't have health care, quite often they end up in the emergency room because they have no other options. And so is there in the plan, does it discuss how people are treated that go to the emergency room, not the treatments they receive themselves, but what happens to them after the fact? So they go there, it could be something as simple as, well, not simple, but as like tooth issues, like teeth issues, an abscessed tooth, those kinds of things. And where they couldn't get that kind of care because they couldn't afford it, for example. And I don't know if that affects minorities more, or definitely would affect, poorer people more, because it's very expensive to go to the dentist. But as to, I guess my question is, what's the handoff? So if somebody goes there, they get temporary relief, and then what happens? So I'm not saying you're going to answer that question now. I'm just curious if that's in the report. And then the last thing, what was the last one? Oh, so I really like the name of Whole Health, by the way. I thought a lot about that, and I like it a lot. I think that fits perfect. So whoever came up with that, congratulations on that one. I was speaking to some people in school districts, and they really appreciate the help of the county in bringing in resources to help with mental health of kids. And I was told they could use somebody at least full-time, if not more. So I just want to share that.
Thanks so much. So there is some data in the community health assessment about emergency room visits. But your question more broadly about, that wraparound kind of support is a really good one. And I think there's probably a lot more to this discussion, but I think one response I would give is that it's one of the things we're thinking about with our community health workers, that role as sort of a bridge between health services and the individual or the community. And I think that they can be really instrumental in making referrals and connecting, helping people navigate and connect to health insurance, for example, and to connect to our health insurance navigators. So that's one thing I would offer, but I think it's certainly something that the steering committee and other partners, I think, are very interested in how to continue helping folks who end up in the ER, for example, for an acute situation, but then going forward to avoid that in the future. And the hospital too, the hospital system, that's a big effort of theirs with some of their programs that they have as well to make sure they're reducing those emergency room visits.
Thank you.
So, yeah, thanks.
Any other questions or comments? I just wanted to ask, you said Tompkins County is, in one rating system is the second healthiest county in the state. Who's number one, do you know?
Oh, it's one of the downstate.
Yeah, it's usually Nassau. Nassau and Westchester kind of go back and forth in that area. Since they've been doing these, we've remained in the top 5, I think. And it's usually between us, Westchester, Nassau, I think one of the North Country counties as well. It's great to be ranked at the top, but it's really all about what you're looking at and what's important. And I think, as Sam has pointed out, while we may be ranked at the top of that particular ranking, we definitely have areas where we can continue to improve. So we're going to try to focus on those areas and make sure everyone feels like we are one of the healthiest counties in the state.
I'm going down to Nassau County in 2 weeks to visit my mother. I'm going to sneeze on people while I'm down there. Bring them down.
Thank you.
Thank you. Please strike that from the record. All right. Okay. Well, thank you for the presentation. And we have one resolution from the Department of Whole Health, which is authorization to increase hours, various environmental health positions, Department of Whole Health. Is there somebody that will move that? Randy moves. Susan seconds. Any discussion? Amanda?
Did this go through budget? Or was that a different one?
It did. It went there before last week, I think.
Making sure I'm not having double memory.
I'm going to ask the question that I always ask for these resolutions. Do these employees want their hours increased?
Two of the positions are vacant. One was just hired in with the expectation of being at 37 and a half, and the fourth person is supportive of the increase.
Good, thank you. Any other discussion before we vote? Okay, all in favor? That's unanimous. Thank you, everybody. Any last comments from the Department of Whole Health?
No, I don't have anything else, Dan. Thank you.
Great, thank you. All right, then, we're moving on to the Office for the Aging. Hello, Lisa Monroe.
Hi there.
So I asked Lisa to do a short presentation today, or a little, some information about home health aides. We did this last year at this committee, and I always use the word crisis when I refer to this situation. It's not something that I have like a connection to in my life. I don't know why this issue calls out to me so much. I think it's one of those things that you never think about until you need it, right? Until someone you know needs it or you need it yourself. And then you would find the reality that there are way, way too few people doing this kind of work compared to the need that's out there. So I wanted to ask, to bring it up again, to shine a little light on it and to hear updates about what's going on, if there are updates, or just the general situation. And then also, last year, right around this time, the county did implement a new program, so thought it'd also be good just to hear how that program is going. So, Lisa, you're on.
Great. I'm gonna share my screen, and I'll try to keep it brief, but please ask questions if you have them, or write them down, and we'll get to them at the end. Just want to make sure. I got to move this a little bit. Just trying to get the full PowerPoint on here. Can you see that?
Yes.
Okay. Okay, so yeah, as Dan said, I kind of went through this last year, explaining a little bit about the situation with home health aides. And really, there's not any significant changes. There are some things that I can update you about, and I know there's a couple new people on the committee, so I thought I'd go over what models and situations we have locally too. So, I have this slide here because Aging in Place is really a priority program for us. It guides our mission as far as keeping people with long-term care needs in their homes and communities with quality of life. So, Aging in Place is really one of our programs and services really guide what we do in that area. So as far as New York home care models, these are, I'm just going to go over quickly what we have in our community and what is in larger in New York State we have. So there's the certified home health agencies. Oh, also keep in mind that we all use the same aides. So there's all these different models, but we're all using pretty much the same home health aides to do this work. So certified home health agencies, that locally is VNS. We have then there's licensed home care service agencies, which locally is Clausen. There's caregivers, VNS. The whole health department is on there for specialized care, and also Staff Kings. And licensed home care agencies can provide PCA too. They call personal care, more like bathing, grooming, dressing kinds of things. Things that really people need to be. They would pretty much qualify for higher level care if they didn't get these things in their home. So there's also hospices. There's non-licensed companion care, which is more of a PCA level 1, which is kind of supportive services like housekeeping, cleaning, cooking, laundry services, things like that. They're more of a companion care agency. There's a program called PACE that's not available in Tompkins County. Then we have long-term home health programs, which is also VNS, consumer-directed personal care assistance programs, which is basically, hiring someone that the client, the consumer is in charge of their hiring and firing. And our fiscal intermediary for that locally is FLIC, which is the Finger Lakes Independence Center. ILCs, again. ISEP is our expanded in-home services for the elderly program. That's the program that we administer here at COFA. Then there's managed long-term care plan. The MLTC plans are, which is a Medicaid managed long-term care. iCircle, Fidelis, and Essentia cover this area. And then there's non-managed long-term care plans run by local DSS. So those are people, they define them needing managed long-term care by needing personal care. So you have to be at PCA2 level to get managed care. And the PCA1 folks that need long-term care services are under the local DSS. So that's a lot there, but and also, of course, there's private pay. People who can afford it can pay privately, but it gets very costly. I added this slide. It's really, although there's people of all ages that are using home health aides to provide care for them in their homes. I'm mainly talking about older adults here in this presentation. This slide just is our population trends for Tompkins County. And you really can see that, 60 plus is the fastest growing demographic. And the one that's reduced the most is the 18 through 44, which is technically most of our workforce that might be doing the types of jobs to help keep people in their homes, like home health aides. Let's see, sorry about that. So how bad is the workforce shortage? The report from CUNY, University of New York, estimates that 17% of home care jobs are currently unfilled. 26 plus thousand new aides are needed to be hired annually just to keep up with the growing demand. And, this report also showed that 71 plus thousand workers are needed each year to replace the home care workers that leave their jobs. So that is, that's a New York State across the board, but it resonates in Tompkins just like it does across the whole country. Why is there a home care shortage? Really, home care workers are essential, but have historically been undervalued and underpaid. The pandemic really only exacerbated this. With high risk home care workers face outweighing the low pay that they receive for their work. It's, high turnover, difficult attracting new workers. This, again, is not a new problem. It's longstanding, low wages and unstable work. What does it mean? What does the home care shortage mean for the people in need of long-term services, supports and services for their families? As a result of this extreme shortage in home care workers, there are tens of thousands of New Yorkers who need home care services, are not getting the care that they need, and are receiving more expensive settings. Like I said, a lot of these people that we have on our caseloads would most likely qualify for nursing homes. So, much more expensive settings, but they could be cared for at home, but without the workforce, we're really not able to do that. Okay. So it was perfect with the CHA presentation. Thanks, Sam. I stole a couple of the slides from the assessment just to I thought they aligned with what I'm talking about. And, we know it's been clearly identified in the CHIP and the CHA that there's racial health disparities and health equity issues. It's really compounded for the older adults who are already isolated and underserved and vulnerable. This image here indicates the rates of, it's preventable hospitalizations and premature death is what I'm going to highlight here. But premature death before age 75 with Black non-Hispanic population is 51%, and Hispanics nearly twice as much, 94%, compared to the non-white Hispanic or white Hispanic, non-Hispanic cohorts. So you can really see that, this is a huge impact. And when looking at premature data across all New York State, some of the highest levels in the highest 25th percent. And I was trying to understand this slide and be able to explain it well. And if Sam, if you need to jump in, if you can, please do. But basically these premature deaths across New York State, some of our municipalities here score in the highest 25th percent. And these are Enfield, Newfield, Caroline, and Dryden. And, you know, these are some of our most difficult to serve areas with home health aides. You know, it's really hard to get people to go out into those areas. And, you know, if we had the home health aides to go into people's homes, some of these death rates might be a little bit less. They might not be as much premature deaths and have these racial disparities on top of that as well. The next image is more about preventable hospitalizations. Again, it's kind of the same vein, really, and that Black non-Hispanic adults and white non-Hispanic adults have been on an upward trajectory from a low of 10 per 10,000 preventable hospitalizations in 2016 to now, actually 2019, it's 104 per 10,000. Which, you know, I feel like this is really making it even more critical that we work towards solutions to help these preventable hospitalizations and, you know, premature deaths. This right here is a slide from the CUNY study that I was mentioning before. It's a table that illustrates the estimated savings that would accrue if some of our waitlisted folks were served. Basically, it is showing that the savings based on preventable Medicaid costs and preventable nursing home costs. And this data was just captured from about 8 different counties, but we've surmised that, you know, this is pretty accurate across the entire state. But these were based on NYSOFA's data for people on waiting lists. So it really just represents a fraction of the preventable nursing home hospitalizations and Medicaid long-term support and service costs. Basically, you know, these home care services, we know that, again, I said that they probably most likely would qualify for nursing home placement, and we can keep them with our community-based services and in-home services that we're providing. We can keep them in their home for less than $10,000 a year, as opposed to some of these costs. Last year, when I was here, we were talking all about fair pay for home care. So, yeah, this has been an interesting spin on what has actually happened. You know, our hopes versus what the reality of the situation are kind of quite different. So yes, last year the state was going to invest money into home care worker wages. Workers were to receive a $2 increase in 2022 and then another in 2023. Going forward, the state minimum wage would maintain the home worker wage at least $3 above minimum wage. So that's what we thought was going to happen, and it's not exactly what's happened. So right now, we're finding that the $3 increase has actually worsened the aid crisis. As the funding has passed into Medicaid, the increase was not distributed to any of these managed long-term care plans. They've not passed this funding on to the providers. So many of these licensed home care agencies that I mentioned in the previous slide are facing closure, further restricting access to care. They're not receiving these increases, but yet they're required and mandated to provide these increases to the aides. So what's happening is they're asking our agency to provide those $3 increases to help offset the costs that they're experiencing because Medicaid has not passed that on to them. So there's some work being done around that at this point. Last week, the state and assembly came out with budget priorities. Both houses rejected the cuts to home care and pushed for more, but of course, nothing is final until the budget is final. So see where that goes. Still, how do we fix it? The CUNY report is just one solution. You know, it really is I always say it's a patchwork quilt of informal services that we put together to help people stay in their homes. It's a multifaceted thing, and we have to take the same approaches to try to fix it. But advocating for a family sustainable wage is really, kind of addressing the root of all these issues, and getting, to the bottom of what would provide these folks interested in even doing these jobs. So we'll continue to fight for that and make sure it gets to the right places, rather than having these insurance companies gaining from these rather than the people doing the work. Locally, we continue to work with the Long-Term Care Committee on the home health aid recognition and publicity. We still are having our social support, home care and workforce groups addressing the different aspects of why people aren't doing these jobs. Recently, there was a Fair Pay for Postcard campaign with all of our partners. I think they've collected close to 10,000 different postcards that are going to be delivered to the governor. And then, as Dan said, we hired a home health aide that started last year in January to provide personal care services to our case managed clients. And this is kind of what we're looking at this point. So in 2021, we served about 96 clients, and you can see down the side is how they were served. They're either consumer-directed personal assistance program clients, which all these clients are case managed clients, I'll just say that. But the consumer-directed is when they hire their own aide. So about 31% in 2021 hired their own aide. About 46% of our case managed clients were served through an agency. We didn't have our home health aide yet, so we didn't have any data there. And then our case managed only unserved waitlist folks were about 23%. So now in 2022, we served 93 clients. You can see that the consumer-directed program continues to go up. People are still needing to find their own aides to help serve them. And the agency numbers are just continuing to plummet. There's just no aides. We lost an entire agency because they just have no aides. And they actually even moved out of Ithaca. They're running out of their Binghamton office now. But our COFA home health aide has been able to serve about 20% of our case managed clients, which has been amazing. And as you can see, it's decreased our unserved waiting list significantly. So we're only down to about 9% of our clients who are only case managed and not being served by any kind of aid. So it's really all I have as far as updates. I'd be happy to answer any questions. It's kind of a lot of information, and there's so many angles you can take to look at this problem, but this is just kind of one of them.
Thank you, Lisa. That was a lot of information. I appreciate it. Are there any questions or comments? Susan.
I just wondered, possibly get a copy of that presentation? There was a lot of information in it.
Absolutely.
Thank
you.
Mm-hmm.
Randy?
Yeah, thanks, Lisa. I know you touched on this in that on one of the slides that people can't get employment if they're taking care of their parents, especially women. It's just at home for me. My mom lives in a house that I own, that I subsidize. My brother takes care of her, and she'd be in a home for sure. And at least 6 or 7 years ago. But she still has her wits about her, but she's going into Oak Hill Manor in May, if she makes it though. So with her sister who is already there. But my mother-in-law lives with my wife's sister, and she's paid some type of stipend for taking care of her. Was that listed here somewhere, or is that something different?
That's what the consumer-directed personal assistance program really is. There's different funding sources. There's a consumer-directed Medicaid program, but there's also, through our ISEP program, our Expanded In-Home Services for the Elderly program, we also do the consumer-directed. So we contract with FLIC, and our clients are case managed, and the aides are hired and expired and the whole process by the consumer, but they turn in their time sheets and activity sheets to the Finger Lakes Independence Center, who's the fiscal intermediary, and they pay them. They cut them the checks and then they invoice us. And they do the same with Medicaid, basically.
So it doesn't matter if it's an actual family member she's living with? Does that matter at all, or?
A spouse cannot do it.
Okay.
There's regulations. Yeah, it can be as somebody that's living with them, but it's typically not a spouse, but it has to be some kind of a person that's able to, do the work that's required based on a care plan. They're still given an assessment and everything, just like if they were to be served from an agency, and they have to do the same tasks that are required per the care plan, and they submit that information with their time to be paid.
Thank you.
I think I probably know the answer to this, but this is a nationwide issue, I'm guessing, and do you have any sense how other states are handling this?
I really don't. To be honest with you, I don't. I know what we've done in New York State, and I know that New York State is very connected with the Association for Community Living, which kind of models what other states are doing. They share a lot of information, just like our master plan on aging that's happening. There's currently one in California. So, a lot of the information gets transmitted via these other associations. I think it's pretty much all the same things that we're trying to do. I think until the wage is significant enough for people to make a living doing it, we're really not going to make much of a dent into it, or we have to figure out something different. Otherwise, people are going to be going into, these other higher cost situations, really. Right now, another thing that I didn't really mention is there's Medicaid expansion, and I know Kit's talked about this a little bit. The level of eligibility has increased. The financial eligibility has increased, so more people are going to be eligible for Medicaid, which sounds like win-win. More services, more people will be able to have these things, but when it comes to people that need long-term care needs, it's a little different. So now those folks are going to have to go to like an independent assessor, which is via a telehealth call. It's not their own physician, it's not their own nurses, and they get assessed via that, and then kind of get put in the cycle of waiting for home care, and it could be decreased. They're typically put into a managed long-term care plan. Their care hours could be decreased. These managed long-term care companies don't necessarily use local services like FoodNet. They'll send them frozen meals from another organization that could be in Wisconsin. I don't know. It's going to affect people that need long-term care services to be a little bit more underserved than they already are. So that's a concern of mine too. It's a lot. It's just one piece of some of the things that we do, but there's a lot of work being done around it, though.
Thanks for everything you're doing and for the presentation.
Sure.
Randy.
Yes, Lisa, I know that we hired home health aides last year, but I can't remember if they were full-time or part-time.
Part-time right now.
Part-time?
Yeah.
If they were both went full-time, would they go full-time, and could you find employees if you had funds to hire them?
I think I could. I think probably part-time works a lot better for people in these positions. The one, we have one right now. The other one is more of a backup. We're using her in different capacities, but we have to have a backup plan for people if they're sick or vacation, so we can pull her in when needed. But the part-time person we have right now worked for the county for 30 some years, I think, and she retired and came over here because she knew it was a passion of hers to be able to do this, and she knew how much it was needed. When we put the job out for this, there was quite a few people that applied for it because we do pay a good wage, and we do have benefits, even if it's a part-time position, and vacations and things that they're not getting in other places. So, there's people sitting on the waiting on our that have applied for the position. So I do think there's people out there that would like to work in this capacity rather than for another agency.
Thank you.
Lisa, do you know what the number is on our waiting list now?
On our, on our client waiting list?
Yes.
It's averages about 25 people a week. The highest it's been in the past year is about 35 folks, which is high considering, we're serving around 100 people only.
Thank you. Any last comments or questions for Lisa? Lisa, is there anything else from your department that you would like to tell us about, or?
Just one thing I wanted to announce that we're seeking nominations for our our outstanding volunteer for older adult that we recognize in May. We'll be recognizing them at our open house. So right now we're just looking for nominations. Anybody that's over 60 that's done something special or amazing in your community. If you want to nominate them, please do. We're looking to get nominations in by April 3rd.
Thank you. Well, thank you so much for that presentation too. It's it's good to shine the spotlight on it once in a while and get a sense of how big and how hard this problem is. So thank you.
Thank you.
Okay. Next up is Department of Social Services, Kit Kephart. Hello, Kit.
Hi, Dan. How you doing?
Doing good. How about we do your resolutions first?
Sure.
First,
Sure, go ahead.
yeah. First one's a budget adjustment, Department of Social Services, American Rescue Plan Act funds for respite bed. Why don't we get it on the floor and then we can talk about it. Amanda moves. Susan seconds. Okay. You want to tell us a little bit about this one?
Sure. So people will probably remember that we had requested about $67,000 in ARPA funds as an over target in the budget for this year. We had actually been trying to work with Cayuga Centers, who have been trying to develop a residential bed. So this would be home-based respite care in someone's home. And they've worked on this now for at least a year and have been really unsuccessful. I think this is one of the issues that we're seeing in addition to all the other labor shortage issues. They've just been really unable to find people that are willing to take this on and to go through all of the training that's necessary to be able to provide this. So we desperately need this respite, but what they have been doing, we knew that when we had talked to them about the home-based respite service, that was our preference, but they have also been working on expanding their facility-based respite options as well. So they've now offered that to us. They've expanded their program. They have a bed that we can utilize. And so this resolution is really about us asking for an additional $40,165 in ARPA funds to be able to contract for a facilities-based respite bed, as opposed to what we've been unsuccessful so far in achieving, which is the home-based respite service. So that's what this resolution is really about. We're really hoping that this is something that can come forward so that we have this service available for kids that show up on cases that really need this.
Thank you. Any questions or comments about this resolution? Randy.
Yes, thanks, Kit. What's the definition of a respite bed?
Sure. So respite is, this would actually provide up to 21 days of continuous service. So the definition of a respite bed is really a program or a facility that can provide a child who may have oftentimes has challenging behaviors or has mental health kinds of issues, it provides a way both for the child to get away from maybe a foster environment, maybe, if they're in crisis and they need a higher level of care, it provides a way for them to get some of those support services. Basically, it provides a way for the child to go to a place where they get services, they're safe, they get a chance to be away from the environment that they're typically in. And oftentimes we find that respite beds like this provide a preserving function when it comes to things like our foster care system. We might have a very dedicated foster family, but people get tired, right? They're working hard with kids, and it is a constant and ongoing thing in your home. And sometimes everybody needs a break. And sometimes, rather than a family saying we can't work with this child anymore, if we have that intermittent opportunity to provide respite, we can preserve a foster situation. The other issue is that sometimes we are in a situation where we're waiting for a bed to open up in a facility when a child is either mandated to a facility, or if we have determined that the child needs a higher level of care. But a lot of times, because especially during the pandemic, facilities have limited their numbers of beds, or there have been closed beds, we sometimes are waiting for a while. So this is also another way that we can keep a child safe. We're able to provide an alternative. If we end up in court and the court is ordering that a child go into care, but we don't have the exact thing, we don't have the exact program, this is a way to remedy all of those situations by having this bed available.
Thank you.
Sure.
Any other questions or comments? Let's have a vote then. All in favor? That is unanimous. Thank you. All right, and then the second resolution, budget adjustment, Department of Social Services, Code Blue. Somebody want to move that? Get it on the floor. Randy moves. Amanda seconds. Kit, you want to tell us about this one?
Sure. So I think, as everybody knows, our homeless population has really increased. We're not alone in this. This is a statewide challenge right now. We've really seen the numbers jump. In the last at least 2 months, maybe more than that, we're averaging at least 200 persons who are being sheltered a night. Sometimes it's risen as high as 250 or in that range. So we've really seen our numbers jump this year. We are working diligently with the shelter provider right now to look at ways that we can kind of try to address some of that. But as people know, the majority of the increases the majority of the increase of need fall in our Code Blue program, which is 100% state funded. So we are looking to meet the need. We are looking to increase our budget approval for another $1,405,538 to manage this need and to be able to provide the services until the Code Blue season ends. Typically, that's around April 15th. That's the kind of standard contracted period. But Code Blue can serve at any time of year as long as it's 32 degrees with wind chill. So that's what this resolution is about.
Thank you. Questions or comments? Just to be clear, Kit, this is we will get reimbursed for the money that we spend on this. This is just to kind of have the money available, kind of a cash flow thing. Is that accurate?
Correct. So yes, Code Blue is 100% state reimbursed. We have submitted a revised plan to OTDA, letting them know that we are seeing, like I said, like many other counties, we are seeing significant increased need, and that we are requesting that they approve a plan for a higher amount. It is 100% state reimbursed and totally based on what we project right now. It could come in lower than that. I certainly hope it does, but we just need the spending authority to be able to move forward. Yeah.
Anything else? Oh, Randy, go ahead.
I'll try to temper my questions a little bit. You have 250 maybe people who are in this program now at the peak, and when it gets above 32, those people are not going to be in hotels anymore. So are you concerned with where they're going to go?
So so there are two primary funding streams for sheltering people who qualify for shelter services. One is Code Blue, which has really almost no requirements that it puts on people. It's really there as an emergency sheltering option for people who find themselves homeless and need services. When Code Blue ends, or even during Code Blue, the temporary housing assistance, which is a part of the temporary assistance that the state provides, that funding continues to remain. We encourage people always to apply for temporary housing assistance because it comes with more services provided to people, but it also comes with requirements that people need to be meeting as well to continue their eligibility. So a lot of what we see in the winter when Code Blue is available is people will decline their temporary housing assistance and they will move over to the Code Blue funding stream, over to that Code Blue program. And then when we get close to that Code Blue season coming to an end, people will reapply for temporary housing assistance. So the answer really, Randy, is we always worry about people, and we always want to make sure that, you know, nobody is out in the cold, nobody's going without services, people are safe. But the reality is that we do a lot of outreach effort. Us in the shelter system does a lot of outreach to people to make sure that people are really fully aware of the fact that there's another option, that nobody ends up just having their services cut off and they still have need. So we do a lot of work around that to make sure that that everybody stays safe and has supports. So.
Thank you.
Sure.
Any other questions or comments? Okay, let's have a vote then. All in favor? That is unanimous. Thank you, everybody. Thank you, Kit. Is there anything else you want to tell us before we move on?
I don't think so. Thank you so much. I appreciate everybody's support.
Thank you. All right, next up is departmental updates, and we are starting with Kate Shanks Booth, County Youth Services.
Good afternoon, everyone. I have a couple of updates for you that I wanted to get to. One that I had reached out to Dan that I'm excited about, but also when talking with Bridget, she mentioned that I might highlight this because some of you may not be aware of it. In 2021, online sports betting was legalized in the state of New York. And part of that deal was that there would be part of that money, about $5,000, would be earmarked for youth development or youth programming. So last year we had a new round of funding that became available, Youth Sports and Educational Opportunity Funding. It was worth about $1 million. Not in Tompkins County, we received a portion of that. And we were able to utilize that money. We had a really quick turnaround on the time that it came, but we worked with our CCE Rural Youth Services program. We were able to bolster some current programming that they have and create some new programming around sports that teach life skills. So it's a very loose interpretation of what recreation might mean or sports might mean. We bought, let's see, what did we do? We bought cross-country skis. We bought some geocaching equipment. We did some dance lessons. There were some swim lessons involved in that. And the idea that these programs serve underserved populations, so it can be women, young women, LGBTQ, people with disabilities, low socioeconomic statuses. And so RYS, Rural Youth Services, especially focuses in the rural areas of our county, and they do a lot of good work. And so it's a really natural fit. So we were able to buy this equipment and start these programs, and they have taken for example, the cross-country skis are going around to the different municipalities, so the kids are getting to share in that experience, which is really cool. And so we've got additional funding this year that has come in, and so that's coming not through the Office of Family and Children's Services, through the state, New York State Association of Youth Bureaus, municipal, which we are a part of that. And so I just wanted to highlight that and let you know that that funding is coming through, and we're doing some really cool things. This year, we're looking to partner with a couple of different agencies to see if we can't do 2 or 3 things like this around the county. And we see that being a funding stream that will continue. It is separate from what we currently get from the state, but it's a really great opportunity, and we're excited about it. So I just wanted to highlight that. Any questions about that?
Kate, roughly how much money came in? Just, do you have an estimate?
Oh, yeah. So, sorry, I should have said that too. Last year we got about $10,000. This year we're looking at about $33,000. The allocation is supposed to go up to $50,000 per county, or would max out at $50,000 per county, but they determine that based on a formula at the OCFS level. So we're really excited about what that looks like. And they've been really, they really have encouraged us to be creative and think outside of the box and really be able to provide opportunities for these populations that otherwise just wouldn't get access to those things. And so it's been really cool. I think I had the opportunity to go, we're working with the Poets Landing in Dryden, and they did I guess a beatbox sort of hip hop dance deal that they did. It was really cool, and the kids were having a great time, but it really wouldn't have been possible without this funding. So it was fun to see them sort of figure out they might have interest in something else and be exposed to people who do that for a living and provide those services. So
thank you.
No. Second thing that I wanted to provide an update on, and I'm really happy to report on this. If you'll remember, in the 2023 budget process, Legislator Randy Brown came to our department and asked us to help him with an OTR to hire a project assistant to do some resource mapping at the municipal and county level around what youth services are available, looking particularly at mental health services and also youth development services as those are preventative in nature, and just other things that kids, we know kids are not engaged, and I don't want to say a post-COVID world, but in the world of living with COVID. And so we started on this, I guess, journey. And I'd like to report that we have hired a project assistant, Miriam Ginsbar, who is a Cornell graduate, who will be starting on April 3rd. She has a really great knack to deal with data. She understands how to ask questions, surveys, categorizations, and understands how to do software, but also really interpersonal. So she'll be able to help us with a lot of the different components. I think she has actually a perfect skill set for what we were looking for. So that was I'm really happy to report that, because that makes the deliverables that we're going to talk about here in a minute possible. We've decided that we're going to focus on ages K to 12, and then we're really going to be looking at these through the municipal and the county level. We're going to provide a comprehensive list of services that are provided there. We're really looking in 4 categories: youth development, mental health, recreation, and community, and then there'll be a 4th that will be other. And that will fall into things around runaway and homeless youth, CSEC, sexual abuse, and those sort of things, so that we can get an understanding of what is happening on the ground. We do know that there have been bodies of work that have been done in some of those. For example, there's a lot of work around mental health and some resource mapping that happened with the Systems of Care Collaborative Solutions Network. I know there was one of the local funders provided a couple of interns that worked on some stuff. So the idea is that we'll pull from what currently exists, create some lists of what's out there. The next step is then we're going to take those lists and we're going to go out to the municipalities. We're going to start there, and we're going to make sure that we have updated lists. We're going to see what's available. We're going to make sure we're capturing as much information as we can. Ask families, parents, youth, community partners, schools, the agencies that are providing, the services, and see really what do we need? What do we need more of that we currently have? What don't we have that we need? And then what are the barriers to accessing the things that exist, and what might be the barriers to accessing the things that aren't there? And the goal is that we want to take all that information and do some analysis of that data and provide a report to you guys that will really allow you to look at how some additional investments in youth services in those areas, what their impacts might be and how much that would cost. And really hopefully give you guys some information just to know, we've talked about the CHIP and the CHA. We work really closely with Sam. She does a great job on that. We're also talking to mental health and some other folks, and just seeing how we can have the biggest impact on youth, because we know they're fighting so many different challenges, and this really gives us a really good foundation to make sure that we are doing what we're charged with. It's just really making sure we're impacting youth and helping them thrive. So that's my update.
Thank you, Kate. Are there questions or comments? Randy?
Thank you, Kate, for the update. I would just like to add that the thought on this, I think, was to focus on the programming that's currently available out there, not creating all new programming.
Yes.
We want to say these are all things that kids could be engaged in, and just how do we make that happen, I guess, as opposed to creating a whole new program somewhere. So.
Yes, no, we definitely want to make sure that we know what's out there, right? And understand that we want to get kids engaged in that as well. But one of the things that, you had asked is if we had additional resources, where could we put them? And so that would be where the creation of additional things would come into play, just to make maybe those recommendations. So you're absolutely right. So thank you for your time and your investment.
Thank you.
Any other questions or comments? All right. Kate, anything else from your department you wanted to tell us?
No, sir. Thank you very much. I appreciate it.
Thank you. Okay, next up, Ken Clark, Office of Human Rights.
Good afternoon. I wanted to just share with you for our update. Excuse me, something in my throat. Our programming schedule for this year, I'm going to share my screen and share that with you. Let's see. I think this is it. Okay. And this is our programming, some of which has already occurred and others which will occur during this year. In January, as mentioned in previous HH&S meeting, we had our program on contemporary applications of Dr. King's anti-poverty legacy. And then last month, the program that focused on Dr. James Turner and his legacy at Cornell and within the city of Ithaca. This, in the next week, we will be sponsoring a program on March 31st, which will focus on next steps in the struggle for reproductive rights, in which we're co-sponsoring with Cayuga Health. And that will feature Susan Salashore, Jada Hamilton, and Anna Kellis, formerly of the legislature and now with the Assembly. On April 20th, coinciding with Earth Day, we'll be hosting a program on the role of media, climate change, and human rights. Mark Hertzgaard, who is an investigative journalist and the founder and the executive director of an organization called Covering Climate Now, will be our speaker on that day. I will be meeting on Wednesday with Amy Chalmavong from the Ithaca Asian American Association plan programming in May for Asian Pacific Islander Heritage Month. Also in May, we will be at a date to be determined with the State Division of Human Rights, as I think I mentioned last month. We will be hosting a program on housing discrimination and first-time home ownership and affordability. In June, during Pride Month, OHR is going to be offering a documentary during the Pride Week events, and there will be a one-day film festival scheduled at this moment for June 14th. And so there will be a documentary on the noted playwright and artist and activist Lorraine Hansberry, which will be shown during that time. We are now in process of planning Juneteenth events in our collaboration with the city of Ithaca. And we will be doing 2 events on June 21st, which will be the second annual Black Business Expo. Last year, there was one held at the Tompkins Center for History and Culture. We'll plan to hold that in the same location again, and a keynote speaker, which we will be identifying shortly. July, we'll collaborate with our colleague Lisa Monroe and COFA on ageism and human rights. And in August, with with Veterans Affairs on veterans' rights as human rights. In August, the coalition, the Tompkins Coalition, Tompkins Civic Engagement Coalition, will be planning an event which will be a celebration of democracy, and which corresponds with a resolution that Jeff Furman will be bringing to the legislature tomorrow to request that August 6th be recognized as Celebrate Democracy Day in Tompkins County. August 6th was picked because that was the day when the Federal Voting Rights Act was signed into law in August 1965. And so the coalition is planning an event or a series of events on that day or near that day toward that end. And then the rest of our emphases for the remainder of the year are outlined for September through December, and with speakers and particular themes to be determined. I wanted to share that with you in terms of what we're planning to do for 2023. So that's a note. Would welcome any questions or comments.
Thank you. Questions or comments for Ken? Susan?
I just wanted to say I attended the online celebration of Dr. Turner, and that was an absolutely fabulous program. Thank you so much.
Oh, thank you. Thank you. That has been one of our most viewed events. The last I checked at the end of last week, about over 250 people had seen it since total, which would include the audience, the actual live audience on February 28th. So that has generated a lot of buzz, so to speak. And so we're really appreciative of just the excellent contributions our panelists provided, and which was, I think, a fitting tribute to, a significant figure on our local landscape for over 50 years.
Thank you. Any other questions or comments? Ken, thanks for sharing the whole calendar. It's great to see the scope and breadth of the topics you're covering and spread out over the whole year.
Well, thank you, and I will make sure you have a copy of this.
Perfect. Thank you.
Sure.
All right, let's move on. J.R. Claiborne, Veterans Services.
Okay, there we go. Can you hear me now?
We can. Hello.
All right. Good afternoon, everybody. I guess the big news in town was this past Friday was Senator Gillibrand came in town to our newly opened VA clinic that's up in the Cougar Mall. They moved it up the road about, maybe a mile and a half from out by Niseg to where they are now. And she took this time to not only visit the new clinic, but also to call attention to the new PACT Act, which is the Sergeant First Class Heath Robinson Honoring Our Promise to Address Comprehensive Toxins Act. And that act actually is something signed by Congress that helps veterans and service members exposed to toxins by establishing presumptive service connections to certain illnesses, which by setting up the presumptive service is supposed to help the veterans get direct linkage to VA healthcare, and in some cases, compensation for those illnesses. There's a press release both on the Senator Gillibrand's website, which she has me quoted, and there's also one, the WHCU did a short on the story too. I did a short story on that. And the press release actually has some information at the bottom of it about it's kind of like a short fact, so that if there are any questions that you could look at that and get some information on it. I want to extend a thank you to legislators Brown and Pilar for visiting my department here this couple of weeks ago. They got a nice tour. I hope they think it was nice, a tour of my place and just an orientation to what I do here at Veteran Services. And to our new legislator, Curry, we'll have to get our dates set up soon. So thank you for letting me know, and I look forward to visiting with you. Right. And lastly, I want to give a thank you to both Jay in assessment, Jay Franklin in assessment, and Dominic Grecchio in communications. Jay had reached out to me late last month to let me know that the town of Caroline had just expanded the veterans tax exemption to include Cold War veterans, which are the veterans basically in between Vietnam and, well, between Korea and Vietnam, and then between Vietnam and the Gulf War. And so this is something that extends that veterans tax exemption for property tax that they didn't have before. This was short turnaround, so it was at the end of February. Jay put together some information. Dominic helped whip it up and turned it around into a press release that we would got out to our veterans because we had a March 1st deadline for the current year. So we'll be getting a little jump on that ahead of time for next year. But by doing that act, town of Caroline became only our fourth municipality in Tompkins to actually offer the tax exemption, property tax exemption to our Cold War veterans. And that's really the big things I have. Tomorrow will be a long day, but the fun of it is I have my Warrior Writers meeting. Our session is this tomorrow evening, so that's always a good time for the guys that come through.
Any questions or comments for JR? Randy?
Yeah, JR, thank you very much for hosting us. I learned quite a bit every time I go to and meet with a department. I'm amazed. I learned a lot of things I didn't know. One of the things I thought would be good for you to share was you gave us a slide on the positive economic impact to the county for veteran services. So it might be a good slide for you to share with the entire group to see the total amount of dollars that are coming into our community through that. So
I will do that.
Any other questions or comments for JR? All right, JR, thank you.
All right, thank you, everyone. Take care.
Next up is John Mazzello from the Human Services Coalition. Hello, John.
Hello, everyone. Thanks for having me here today. I'm stepping in for Cindy once again this month. Just a couple quick updates to share with you. The first, I'm just pleased to share that HSC has hired a replacement for Cindy's old position when she was our Director of Leadership Development and Consulting before she was promoted up to Executive Director. So I'm pleased to share that we have a new person whose role it will be to work with the agencies that are looking for assistance throughout the community. Her name is Shasta Savage. She's got a background as an Executive Director, so she brings that peer perspective. She's also been a consultant, a trainer around DEI and trauma-informed care, worked at Cornell and several other places. So we're really excited to have her on board. She's just been with us for about 2 weeks now, and glad to have someone who can support the nonprofit organizations, particularly when they're looking for assistance with, challenges related to their boards of directors or thinking about things that the executive director could use another person to bounce some ideas off of or to bring some resources. So we're excited for that position to be filled again and to be able to bring that. So if you're in your travels, come across any organizations looking for assistance, we've got Shasta who can be working with them now on that. The other update, just to let you know, every 3 or 4 months or so, right, I guess maybe 4 to 6 months or so, we do connect back with all of the agencies that we review as part of the process for community agencies that goes into the county budget every year. And so we like to check with them regularly, 3 or 4 times a year, just in a really neutral setting, separate from any kind of application process, to see how things are going, hear what trends they're seeing, and understand what's going on with all those organizations. And we're doing that again now over the next couple of weeks. So just so you know, in the coming months, we should have some really good information about what the organizations that the county supports are seeing, what some of the challenges are, what some of the successes they've had over the last couple of years. Again, as Kate mentioned, not post-COVID, but kind of living with COVID, a lot of things have changed for organizations. And so as we move into a new budget season, again, for the rest of the year, hope to be able to bring that information to you in an aggregate way so you can understand what some of the challenges and opportunities are in the nonprofit sector in Tompkins County. So that's my update for today.
John, questions or comments for John? I'll just mention that I was talking with Cindy Wilcox, and we're working on having the Human Services Coalition do a little presentation at a future HHS meeting, maybe next month, maybe the month after, we'll see how it works out, about the community agency review process that you mentioned, John, because it's a major service that Human Services Coalition does for the county government, and it would be good just to hear how it all works. So.
Yes, absolutely. We're looking forward to it.
Good. Me too. All right, well, thank you.
Great, thanks, everyone. Thanks.
Next up is advisory. Let's do the advisory board appointments. We have to do that. So we have a number of appointments. We have Dr. Andrea De Lima for the Board of Health. We've got Travis Brooks and Randy Brown, Recreation Partnership Board. And we've got Jennifer Dean and Ian Schachner to the Tompkins County Youth Services Board. Somebody want to move that? Amanda moves. Randy seconds. Any discussion? That was very cute. You guys did this. Any discussion? Ready to vote? All in favor? All right, that is unanimous. Thank you. Let's go back one step. Comments from committee members, liaison assignment reports. Does anybody have anything they want to share from the committees that they or advisory boards they interact with, or anything else? Okay. Let us do the minutes approval. Anybody want to move the minutes for February 22nd? Susan moves. Randy seconds. Discussion? Okay, all in favor? That is unanimous. Thank you. Any other business today? All right, the meeting's adjourned. Thank you, everybody. Thank you.